I'm thrilled to have the ability to host this afternoon's scheduled webinar. Our wonderful physicians are going to share their story about Aliyah and their jobs in Israel, their adjustments, and what they are doing here. They are all impacting and making a huge difference just by being here, something that we hope that one day you'll do and join us here. My name is Rachel Berger. I'm the Vice President for Employment in Israel for Nefesh B'Nefesh. What we're going to do is going to chat and hear everybody's accomplishments and achievements this evening. And feel free to ask any question that you have in the chat, and I will present it to the panelists as we go through this webinar. I will start with Steffi. If you can just tell us a little bit about yourself, your professional training, and your Aliyah. We would love to hear.
Okay, so I'm Steffi Sepsner. I grew up in Lakewood, New Jersey. I went to, well, fast forward to college, I went to Stern College. Pretty soon afterwards, I met my husband, and together we kind of decided that we saw the path of making Aliyah in our future. We really wanted to do that together. We both were, I was applying to medical school at the time. My husband was doing dental school, applying to dental schools at the time. And we kind of laid out a path of, God willing, we want to go after residency in order to, make it easier to be here for a while and train in order to go there and have basically set jobs, God willing. So I went to New York Medical College. I had kids along the way through medical school. I had one before medical school, and then I went to pediatric residency in it was UMDNJ, then went to Rutgers in Newark. Did that, and then stayed on there as a attending physician, working as a hospitalist and also in the pediatric clinic there, which was great training for me because it kind of opened my eyes to a lot of things that I necessarily wouldn't have seen. We ended up making Aliyah 2 years after working there, so total of 5 years of working in the States. And we made Aliyah in August 2017. So my husband and with my 3 kids and my dog. Thank God we moved to Modi'in. I spent the first year already telling myself that I would give myself a year to get acclimated, get my kids acclimated. It's hard at the beginning to get them, into school, make sure the kids that you're dropping off and gone aren't, holding on to you as you're letting them go. It took a while, and I was happy to be around that year to do Ulpan with my husband. He started working that year, and I waited to feel out different opportunities. I needed to complete a 3-month histaklut, which I did in a Safarofeh the following year a year after we moved, starting in October. And by January, after speaking to people who work in Maccabi, I ended up starting in Modi'in Elite as a pediatrician, which is a very religious neighborhood. And I've been working there for the past 2 years. At times it's, definitely a lot of challenges, especially during this time of the pandemic, but it's very rewarding. And I get a lot of pride when I see, my patients, wanting to come see me, wanting to come talk to me, and appreciating my help and guidance. So it's been very, very rewarding. We're very happy. We're living in a new neighborhood in Modi'in called Siporim. My kids are very happy, thank God, in school, and we thank God we're doing very well. And I think that's it for me for right now.
Okay, thank you.
No problem.
Dr. Penina, can you tell us a little bit about your story?
Yeah. So my name before Aliyah was Paige Applebaum Farkas. Some people may know that name better. I made Aliyah 11 years ago. I was a little more further along in my career at the time. I actually just, going back to that same parallel as Steffi, I went to Queens College. I went to Albert Einstein for medical school. I did my dermatology residency at Einstein as well, and met my husband when I was a resident, but it was part of the necessary paperwork that he was willing to make Aliyah. I didn't call him in on it for a couple of years, but that was key. And then settled in, we moved to Teaneck, and I worked in a few different places, in a place called Ridgewood, which is not far from Teaneck, and then also in Jersey City, and at this first time in Livingston, figuring out where I wanted to be. And then thank God, Hashem blessed us. We had a very big practice in Ridgewood for about 15 years. And by the time we made Aliyah, we had 3 other doctors working for us and a couple of medical physician's assistants and 20 staff members. During the second Intifada, we came to Israel as a sort of a support mission with 20 family members. And I reminded myself what I really wanted to be doing and where I wanted to be. And then it sort of began, I guess, the process of recognizing that life in the States for me, both professionally and personally, was not giving me the satisfaction. It was called, whether burnout or whatnot, it just felt like it was all about living to work as opposed to having a lot of quality of life, a lot of accumulating stuff, and not really having the meaning in life that I was looking for. And then in 2008, when finances took a downturn, recognize you can't save money as long as you want. Hashem has plans, and he's you have to do what you have to do. So in 2009, we had a few false starts, but thank God then we successfully made Aliyah. I'll tell you, the truth is we really did most of our due diligence finding a community that was right for our family. We came on a pilot trip as a family, went to different different friends. We got names, and we tried out different communities with the family. We are in Efrat, which was really, really a soft landing and fantastic for our kids, Baruch Hashem. Our kids at that time were ranging from age 2 to 15. So we didn't come with the easiest age group, but really, Baruch Hashem, then and even now, our kids always have said they're so happy that we made the move, and that they feel privileged that they live here. Our oldest is in medical school, 2 next in university, 1 is right before Army, and our youngest is 14 going into high school. And Baruch Hashem, I think that they feel that they're happy to be, that they feel happy to be here, and they feel very Israeli and very blessed, as do I. I did not do a lot of professional pre-thought. I came and I sort of jumped in, and like Steffi said, I spent the first year really trying to get my family organized, and I have no regrets. Anybody who can manage that, I strongly recommend. It also allowed me a reboot in terms of what do I want and where do I want to be going, and to build things slowly. I did plan at the beginning and continued until the pandemic to continue to work back in the States. I sold my practice to a large group of dermatology practices and continued to go back about every 4th week for the first 5 or 6 years, and then every 6 weeks, sometimes every 8 or 10, depending on the month and the chagim. And that really allowed me the flexibility to figure out what I wanted to do here and work, add in the kupot slowly while I continued to travel. And now, thank God, I have more work than I know what to do with. We're desperately in need of doctors here, so please come. But I love working here. I love, like Steffi said, there's very, very satisfying. It's never ending. And when people ask you to squeeze them in, you feel like everybody's a family member, so you can't say no. But when I say that I have meaning in my life, in terms of really the age where I'm 50, almost 56, I could feel like I could be burning out. I feel like I feel like a shlicha for Hashem to bring, here I feel it more for whatever reason, and people appreciate, the patients appreciate it. And I feel like it really is, everybody's a family member, everybody's a friend. There's tremendous satisfaction here. So Baruch Hashem.
Amazing. Okay, Dr. Adami, it's your turn. If you can share with us your story and what you're doing here.
Sure. My name is Adami Farkas. We made Aliyah in 2012. we were sort of the opposite of Penina. It wasn't on the paperwork. I actually didn't tell my wife about it initially. I surprised her when it was kind of too late for her to say no. That's when it worked, thank God. I came right after my training. I'm an interventional radiologist. And I did my residency and fellowship at University of California, San Francisco. And then we came directly after that, directly after fellowship. I initially worked part-time at Hadassah doing interventional radiology and part-time doing diagnostic radiology remotely from Israel for an American company. I did that for about 2 years, and then I transitioned to full-time interventional radiology here in Israel, which is really my passion. I head the interventional radiology unit now at Shaarei Tzedek for the past year or so. It's been interesting and challenging and fun. Hospital practice here is probably, at least in my field, it's a very technology-driven field, and I don't feel like we're missing anything in terms of equipment and capabilities and all the sort of bells and whistles that we had available in the States. In that case, it's wonderful. I find the work very meaningful. I think probably the other doctors would agree that it's a much smaller pond here. So, it's a much smaller pond. So you really do make, it's kind of easier to be a relatively, a relatively big fish because it's such a small pond, and you really do make an impact. There are, well-trained American doctors actually have a lot to contribute here. You may not, sort of hear that from your Israeli colleagues, but the reality is, we all have a tremendous amount to contribute, and I wouldn't change it for a minute. I've thought about for a long time, sort of commuting as Penina did for a while, and I've always, thank God, been able to not do it, even though I've been very close several times, and I'm very happy about that, because to really, especially in a hospital practice, you need to really be here and be invested full time in order to get established, and really become part of the system. I'm overall very happy, and I wouldn't change it for anything in the world.
Thank you. So I want to start with you now, Adami. Can you address the cultural differences or the cultural challenges that you may have had, some surprises perhaps that you did not expect, and how you managed them or learned about them or, dealt with them?
Yeah. I think the hardest challenge is people who don't naturally sort of have a thick skin and are able to be sort of confrontational by nature. I don't mean it necessarily in a negative way. It's just much more the culture here. And sometimes it's even necessary to really get things done, things that are necessary. I find that very challenging personally, just because it's sort of not my personality and my way. But it's just a reality of being here. It's not an absolute necessity, meaning you don't have to turn into a sort of a hard and callous person to work here, but it does take some getting used to. Yeah.
Okay. Penina, did you have any challenges working here that you could just share with our audience?
I think one of the biggest challenges, and I read it, someone wrote an article in the Jerusalem Post, who was from the patient perspective, is managing the patient, the line outside your office, because it's a totally different animal than in the United States, where you have a waiting room and everything's orderly, and it's like a totally different world. You have to be the one who's in charge and make sure nobody bullies their way in, and you have to, and can do it kindly, but it's very, very different process. You're, I mean, if someone opens a private practice, then you can really run it however you want to. And of course, people do have that model. I mean, I'm a specialist, so that's a little different than both Adami and Steffi in terms of, you know, that kind of setup being possible. But and I think the other side of it was it's important to talk to people. And I've worked 5 or 6 different places. And one of the things that I learned that's different here is that life is dynamic. As a specialist, like I said, and maybe in other cases, but you don't always love the first job you get because, you know, you're coming in, you're figuring it out. And here, like, people leave something they don't like. As opposed to the States where you kind of schlep along potentially for 20, 30 years at the same job because you feel like you're committed to it. If something isn't what you like and you can't fix it, then there's an opportunity to change and to move on to something else. So that was something that I figured out, and that I didn't have to stay where personalities were too different from me in terms of how patients are managed, because there is that where patients are seen as a commodity to see 9, 10 patients an hour, and there's no taking no for an answer. I could not do that, so I had to move on. Or, you know, I work in cosmetic dermatology as well. Has to be a way of interacting with somebody that I feel is as a physician and not just as a marketplace, which you can see here a little bit more in Israel. So there's definitely some cultural differences, but I think you can find a workplace that works for you. If any of them are so in contrast to who you are and how you like to practice medicine, I think everything is possible. I think that there really is a wide range, and actually that, as like Adami was saying, that well-trained American physicians have an enormous amount to bring to the table here in terms of improving the quality of care for patients and improving compliance and all sorts of other things. So there have been challenges, but I think that either they can be fixed or you can remove yourself from it.
Wow. Okay. Steffi, do you have any challenges that you can share with us and how you've overcome them?
So definitely, I was thinking very similarly to Adami and what Penina said, but for me at the beginning was very hard to patients that have been going to, you know, doctors that have been there for a long time, who you know, would be more freely giving out medication for certain things, or not really sometimes explaining the reason why they were giving certain medications, and then having to come in and not necessarily agreeing with certain things, and having to explain to the patient, you know, this is asthma, you know, and really going through different diagnoses and treatments and what I felt comfortable treating the patient with. And so I had to draw lines basically of what I, you know, was willing to do, and also be flexible about, you know, how to teach the patients or work with the patients for what they were requesting or seeking. So that was definitely a big challenge that I still, you know, work with today. And then also just, I mean, culturally, but language was a big challenge for me, still is. Definitely better than it was at the beginning. I didn't take medical Lopan, but I did on my histaklut. That was my main goal, to pick up the language. I walked around with a notebook, just trying to absorb as much as I could. But you know, being a pediatrician, one of the main you know, tools that we use is our sense of humor and playing with the patient. And a lot of times that's a big you know, I'm still learning how to joke in Hebrew, and you know, so that's definitely a struggle that as a pediatrician, it's very hard sometimes to you know, make the patient, you know, get them involved and get them, you know, a little more excited than they usually are to be there. So that's definitely a hurdle that slowly is getting a little bit better. But
Did you find that Hebrew was like, in other words, that the patients had an issue understanding you, or that Hebrew was a real challenge in terms of working here?
I mean, I've had patients tell me that when I first came, I'm so much better than I am, you know, when I just came. So I was like, oh, thank you. You know, like it's so nice that they, you know, say it right to your face. But no, but I see it in myself already. I'm much more, you know, confident even when I encounter a new thing, it's, you know, I had a patient over the phone asking me for a bone density scan, and she kept on saying that she needed this scan, but I had to like quickly Google translate what she was saying. It's food etsem, and I didn't know what that was. So I had to, you know, there's new things every day that you have to learn and be exposed to, that you have to adapt. But it's if you never encounter it, you're never going to learn it. So it's kind of, you know, every day is a day I learn. So some days my Hebrew is better. I always tell them, you know, when I slept the night before, it's usually better. But it's definitely, I don't know. I haven't taken medical Ulpan, so I don't know if that, you know, is definitely, I've heard it's a very good tool, but for me, I needed to be on the spot and you know, learn as I go. That's basically how I learn with languages. So
I hear you. Okay, thank you. Penina, we have a question from our audience that I'm going to address to you, and you can maybe help us with that. As a dermatologist, do you find that there are opportunities everywhere, like in every city, or do you find that for specialists, like all the city physicians have sort of taken the spot, and Olim have to consider going out, quote unquote, out of town, like not in the big cities?
There's definitely room everywhere for good qualified physicians. When starting out with the Kupot, very often you have to start in a more outlying community to get your foot in the door as a specialist. It depends. And so, for example, in Jerusalem, to get into Maccabi, which, so just to sort of for the audience, there are 4 Kupot. Maccabi and Mu'chedet are like the 2 major ones. Tlalit is also very big, but their pay scale is a little bit less good for specialists, though something I learned is you can negotiate, and you must negotiate, because maybe not the first year, but by year 2, you have to start to talk about, you know, wanting a little bit more money if you need to. But there's Klalit and Lumit, which are sort of from a dermatologist perspective, on the lower end of the spectrum. It took me much longer to get into Maccabi. I started off in Klalit and Lumit, in the Gush and in Beit Shemesh. Those were, you know, prime areas. There's lots and lots of, the populations are expanding exponentially, and there's lots of space for that for doctors. And Maccabi, I had to start, like I said, in a more outlying community. And then as soon as there was openings in other places, then they sort of put me in there. So it was a process, but the truth is it was that way for me in the States. I started in Ridgewood, which is Paramus, which is full of dermatologists. I had to work in 3 other places before I could have enough of a practice to really build. But there is no question, once you develop a reputation and once you, you know, get your feet wet a little bit, there's room everywhere. You do not have to work in the in outlying areas, so there's a lot of benefit to that as well.
Okay, thank you. Adami, there was a question directed at you. How was your transition into Hebrew because of all of the writing that's involved in your job?
I'm not sure if it's clear. I actually don't do any diagnostic radiology, so I don't do much writing. I only do image guided procedures. But in any case, I came with fairly good Hebrew, just from growing up and visiting Israel and going to a school where I learned Hebrew. But the reality is you learn most of it on the job. I mean, my wife has taken Ulpan, but she doesn't use her Hebrew so much, you know, day to day, and because of that, it's not very strong. It's just a matter of being in a setting where you're going to use it all. That you can take, you know, Ulpan 3 times. If you don't use it in your day-to-day work, chances are your Hebrew is not going to be very strong. So in healthcare, almost everyone speaks some English. So I think there was one question: do I need to know Hebrew to work? And the real answer is no. The real answer is no. Certainly in a hospital setting, but you can get by. But I think you know, it's certainly helpful to know at least some Hebrew.
Wow. Okay, thank you. I'm going to address another question at you. Can you, if you can, comment on the structure of the healthcare system in Israel? You know, well, actually, I wouldn't. I'm going to actually move this over to Penina. Penina, to comment on private practice versus hybrid models. I guess private and public. None of you work in private practice, correct? All of you are working for Kupot or for hospitals
I have a private practice.
also.
Yeah.
So how does that work with the Kupot?
So the truth of the matter is, as a specialist, starting out with a private practice and in the Kupot is a reasonable model, or just even private, because there are people who are willing to pay not to have to wait, because the wait for a dermatologist now, except if you can be squeezed in as an emergency appointment, is easily a couple of months through the Kupot. And some Kupot doctors will see 9 and 10 patients an hour, Kupot dermatologists, and you're not going to get necessarily the time and the attention that you might want. So there is no question that there is a market for private specialty care. There are a lot of people that will pay for that kind of thing. Now there is a rare model which I think the Kupot have phased out, which is where you can have a model like in the States where you can have your own setup and you can accept the Kupot and private practice in one office that's centralized. That's the model in the States, and that's very, very rare here. Like I said, I think that used to be more common and they phased it out. I think that I really think all options, there's all options in specialty care. I think that the Kupot work is very satisfying because it's easy, as opposed to dealing with insurance companies in the States where you need a staff to run after your money. You run a card for the patient and you can pretty much count on the fact that you're getting paid appropriately, and they're paying you for procedures and they're paying you for the visit. It's run by capitation on a revone on a quarter, but there's no headache. You go in, you run the card, and you do what you've got to do, and you write prescriptions, and they're covered, and nobody has to pre-author. Very rarely. There are some things that need to be pre-authorized, but it's just, in that way, it's a pleasure. If you have a private practice, the patient has to go back to their Kupot doctor to get a lot of things done if they're anything more involved. So I know it's a big question, but in a nutshell, you can definitely create a model of anything you want. You can work for one Kupot and have private practice. You can work for all the Kupot and have a private practice. Some of the Kupot, and depending on your specialty, will make you sign in your contract that you will not see their patients privately. So that's something that one has to keep in mind if you decide to do, sort of a combination of things, and then you have to figure out a way to manage it if people reach out to you, see you privately.
I would add, in hospital work, there's also a combination option. So, for example, the Jerusalem hospitals, you can do both. If you, I do both. I mean, I work in a public hospital, but it's also a private hospital. So if a patient wants to have a specific doctor do their procedure in my unit, for example, then they're technically a private patient, and the physician gets a fee for that. So you can actually do both. If you work in the, and that's applicable to both Shaare Zedek and Hadassah. If you work in the Merkaz area and the Tel Aviv area, it's not the case, and you have to do your private work at a separate facility, for example, at a private hospital like Asuta. But again, in Jerusalem, you can do both. I will say, though, that it takes, as a hospital person, it takes quite a while to build up your private practice, because it does involve out-of-cost expense for the patients, and there has to be a reason, at least in their mind, why they're paying to have you do it as opposed to one of your colleagues.
Right, but I want to just add, we haven't mentioned Meuchered, but I'm on Meuchered. That's the fourth. There are 4 health funds in Israel: Clalit, Leumit, Maccabi, and Meuchered. They do offer a discount once a quarter to use a specialist in the hospitals. So it's true that it's out of pocket, but it is not nearly the amount. It depends on the Kupot. It is not nearly the amount that it used to be. So sometimes it's I don't want to say nominal, but you can then choose your doctor, because once a quarter you have the opportunity to use a specialist and get the discount from your Kupot. So one of the other questions that people have, and I'm going to address this to Steffi, is about working part-time, working full-time. Can you shape your own schedule in terms of family practice or pediatrics?
So I actually came knowing I wanted to do part-time. Thank God my husband's working too. I work 20 hours a week, which I could never do in America. I'm sure no one would even want me to work there. It was, much harder making my schedule as a starting physician in America. I work 20 hours a week. I was able to, work mostly mornings, which is better for my schedule with my kids. They needed pediatricians. Basically, they needed in the place where I'm working in Modena Elite, there's lots of children. They're also looking, I'm sure, for internists and other doctors as well, family doctors, and they needed physicians. They're happy for me to work more hours. Also, I kind of limited it. But you can do well. I work actually as a sahir, which is a salaried, which I continue to work as that, and I chose to work as that. For my schedule, it was a better option than having to worry about getting an accountant. And basically, there's two options. You can either be an atzma'i, an independent, or a sahir, a salaried. So I was very happy to, have them work out my vacation days and my sick days, and anything that I needed. And then I'm basically a salaried doctor, and which is 20 hours a week. And thank God it's a great schedule. And even some days, like, I moved around my schedule when I need to, and they're very good about it.
That's amazing. That's
Thank God.
so you have a lot of flexibility.
Mhm.
Okay. Penina, what about you? Are you an independent or are you a salaried professional?
Independent. I think I think all dermatologists are. I don't know about all specialties, but I think that they all continue independent contractor. There's all sorts of tax issues that need to be addressed when people do that. You have a little latitude of 10 years or whatnot to figure it all out. But in terms of your Social Security, et cetera, so it's definitely worth, when people get settled, to just find an accountant here who knows American law well and working with Americans, so that you can sort of figure that out and be on top of it.
Mm-hmm. Okay, thanks. Oh, there are a lot of questions about making a living that are coming up from our professional physicians that are asking us. So, can we address maybe the salary discrepancies between Israel and the United States? Adami, I'm gonna ask you first.
This is obviously on everyone's mind, and it's I'm not avoiding the question, but it's very, very job specific, depending on your specialty and your work setting. So there's no answer. I mean, I think there was a recent statistic that people generally physicians in practice for something like 10 years averaged something like 60-something thousand shekel a month gross salary. That's again, there's extreme variability depending on your specialty, the number of hours you work, where you work, whether you work in private practice versus purely as a public role. So I think the real answer is people need to speak to someone in their specialty who's been around for a while, and preferably who's worked in several different work settings. That's really the answer. There's no answer to that. But it is as far as average Israeli salaries go, physicians are on average on the very high end, and people, even by American standards, really can earn a very respectable living here. But again, it's very, very job and situation specific.
Penina, do you have any comments?
Yeah, I spent many years raising a family in the States, and it's definitely a shock if you think about the number. So 60,000 shekel a month is a phenomenal Israeli salary. And for an American, if you convert it to dollars, it feels quite shocking. But one has to keep in mind that many of the expenses are far less. So first and foremost, if you're paying for yeshiva, that you're taking that out of the equation. You're not paying the health insurance costs, even many of the other costs that just it takes to run a home and a household in many of the communities in the United States. You do not need that here in Israel. And one of the things that I briefly said that I say regularly when I speak to people is that in the States, I felt like I was living to work, and now I really feel that I'm working to live. And one of the things that I think is the idea opportunity for reboot and resetting in coming to Israel is not having to have that be your primary sort of focus. You have to think about how to create a budget so that what do I really need to live? Because life here is so much more than working. People, aside from friendships and neighbors, you're learning, and there's classes, and there's time with your family, and time, other things that people take the time to do, which in the States I never did. A very big, thank God, successful Bli Ayin Hara dermatology practice. That was it. I mean, it was wonderful, but that was so much of my life. And here, I love my work, and I can manage to give my family the things I want to, and support the lifestyle I want, and I don't have to only be about working all the time. I can also have other things in my life that I take a shear and I won't work in that time. I do a yoga class, I won't work then. I take time for my kids, like mental health days, so that I can make that time, and that is a priority. So I think that it's very, very important to get to speak to people in one field and get a better sense, but not to compare what a salary here is versus salary in the States, because life here is so much more than just the shekel you put in the bank every month. Life here, it's hard to, there's no value you can put, there's no shekel amount on what it is to wake up and say, oh my God, I live in Israel, and that your kids are being raised here, and that in the pandemic today, that every Jewish life matters. And so there's 5 million people vaccinated here. There's no value to that. And you can't compare. I mean, it's a reset. It's a total reset. And people have to be prepared to do it. I was ready in the States because as successful as it could be, it was empty. And anybody who's here who's listening knows what that is, and you're raised with the something more. Life is about something more. And but you can manage here. It's not also like once upon a time, I think, where doctors here were starving, and in the States, medicine has become a major headache. Managing health insurance companies, I know it because I ran a practice for a decade, was torture. And it doesn't have to be that way. You can practice medicine, and it doesn't have to be the entire definition of every moment of your life. You don't have to be absorbed by it. And so that's my bottom line. There's no way you'll make the same money dollar per shekel. There's just no way. Even if you worked every single second, because people just don't, the scale that people will pay a private doctor here, Bo Nagid, for a private dermatologist, high end is 700 shekel for a private dermatologist. I am not comfortable charging that. So just to be honest, I'll charge 400 shekel for a first visit. That's unheard of for private dermatologists in New Jersey, New York. It would be $400. So you can't even talk in the same scale, but thank God, it works. It's okay. And it really does work. It takes a reset. It takes a readjustment. You're going to readjust what's really important to you. But at the end of the day, you have a life which is totally different, and you don't need the Amazon, and you don't need the other things. And I'm not judging, because I brought back 210 pounds of schora every single month. But at some point you stop and you say, it's not really important.
Thank you. Steffi, I want to ask you two questions. One, if you can just address I don't know if you're in touch with your colleagues back in the States, but how COVID was running here, in terms of the medical care in a private situation like you had. And the other question, which will be a follow-up question, not related, is because or due to COVID, is there any telemedicine that's being introduced in Maccabi at all?
Okay, sorry. So for the first question, I mean, colleagues of mine, I did do recently residency, about 5 years ago. So I was definitely in touch throughout. My friends and colleagues were, now practicing all over the world. A lot of them were international, and it's amazing how it took us a little while in Modine Elite where I was working, but we did manage to mobilize and treat and get our acts together now with the vaccine. But it was definitely challenging at the beginning, especially in pediatrics where a lot of the symptoms weren't necessarily so clear, and in private practice when they're coming in, and not private practice, in our practice when they were coming in, and sometimes having fever, cough, it was very hard at the beginning to figure out who needed to be tested, who could be seen, who could not be seen. But I mean, thank God now we have a little bit more of a guide of what to do every day. Things are definitely changing with who's to be vaccinated, who's to be tested, who's to be serologically tested. But it definitely was challenging, but it was no different than anywhere else that I was speaking to people. I was talking to Rachel before about how my father is a physician in Lakewood, New Jersey, which is also very similar to the Modine Elite population. And basically it was mirror images of what was going on there that was going on here. So I kind of, got a little clue about how things were going to start going. So I was able to, kind of, protect myself and be more of a help. And thank God I didn't have to, get sick at the beginning. I was able to protect myself in order to protect my patients. But and the second question was, virtual. So they did set up, it's hard in Modine Elite because not a lot of people have smartphones, but they did set up a system for video chats with the doctor. So all the offices have cameras now attached to the computers, so you can do a Zoom call with your physician in order to show the baby's rash, or see how the baby's breathing, and if using accessory muscles or different methods. I haven't actually used it because none of my patients really have the smartphone technology or computers, but they were sending me emails a lot of times with pictures when they did have that available. But they definitely were quick to get on the technology and start doing telehealth. So people didn't have to come in, and we were doing a lot of phone calls. I still do a lot of tour telephonies, telephone appointments. And a lot of times I was, telling them to do rapid streps at home at the beginning before we knew, what was strep, what was more corona. So we definitely got on that pretty quickly, and they did set up systems that the patients didn't have to come in order to be seen and expose the doctors, which was very helpful.
Fascinating. Adami, how has COVID impacted on your specialty, on your work?
To be honest, not a whole lot. It just means, we had to put on the whole spacesuit when treating patients with COVID. But in reality, not a whole lot. It did take, Shari Tzedek was one of sort of the busiest hospitals in terms of treating COVID patients. So it took its real impact in terms of multiple inpatient departments were converted to COVID wards. And we canceled a lot of, elective or semi-elective procedures, but directly not a whole lot. I just wanted to take a second to answer one question that I think is probably relevant for a lot of people. Someone asked about looking for jobs. So the idea of like job boards and formal job boards, I'm sure all of our professional societies in the States have these official job boards and things. It's much different here. They exist, but it's really completely unreliable, almost as unreliable as, as if you Google, average salary for whatever doctor in Israel. The way to do it really is you have to just speak to people in your specialty. It's a very small country. So if you call, I don't know, call me or Penina and you say, I'm looking for a dermatology job in the Jerusalem area or an interventional radiology job, who's looking, who's open, that's going to be a lot more, or, Steffi, I'm looking for a pediatrician job in the Modi'in area. I mean, it's going to be much more useful than spending hours on Google. It's just not a very well-developed system.
Okay, so I also want to add that Nefesh B'Nefesh is connected to most of the HRs in the different kupot, and everybody is welcome to send their resume to us, either to me personally, rachel@nbn.org.il, or to employment@nbn.org.il. And we're very happy to try to connect you up, as soon as you're telling us when you're coming. And pretty much like Adami said, we do connect you up with other physicians that can help you network your way into a position here in Israel. Penina, have you seen any like telemedicine movement in the 3 kupot that you're in the dermatological area?
Yeah, no, it's thank God it's a real option. Maccabi is the most mitkadem, most advanced of the 3 kupot I work with, but all of the kupot tried to find a way to make it work, whether it was sending photographs, but a lot of telephone appointments, certainly for routine follow-up, and I was compensated. The Israel Medical Society Association got involved very, very early to make sure that doctors who were compensated per patient would get compensated for telephone appointments during Corona. And the kupot also really made an effort. The kupot run for specialists on like a base salary and then a bonus at the end of 3 months, at the end of your quarter. And they really committed themselves to not reducing the base salary, so that, at the end of the game, sometimes some people's bonuses were affected more than others. But there was a real commitment not to leave doctors hanging when sort of everything fell through the floor. And I think I certainly appreciated it. I think most of the doctors here did as well. And there is a sense, I think, that in socialized medicine, and even though in America it's thought of like as a very big bad word, that here it works on many, many levels. First, we see it with the vaccinations, but also there's a certain deep caring, I think, both about your workers as your doctors and about the patients. It's not just a business, and and I feel that as a worker, and I feel it as a patient here as well.
Doctors are part of people's families.
Yeah.
They really are. I mean, as a patient, I will tell you that I've gone and made my doctor feel emotional about how much caring they've done to us. In Israel, when a doctor cares for you, you might bring him, as you said, Dami, you said about the mishloach manot that you got for Purim from different patients. So I will ask you each to think about one bit of advice that you would like to share with the doctors listening in. And maybe if you have a story, also to share a meaningful story to you about living in Israel and being a doctor in Israel. Should I ask you, Adami, to go first?
I need a minute to think about it.
Okay, then Steffi, can I ask you to go first?
So I have no story offhand. I'm trying to also think of my story, but my main advice is Hebrew. Is if you don't find that you're so comfortable with speaking the language, try to work on it as much as you can. And yes, you will pick up the most of it, on the spot, on the job, as you go. But definitely, work on as much as you can beforehand. Because that is a key to being successful. I think that you need to be able to communicate and especially in practice, in pediatrics, you need to be able to talk to the parents and understand what, sometimes I think they're talking about, something totally different, and then I really understand what they're saying. And it changes everything. So it's even the small little phrases, sometimes I say, can you say it in a different way, because I'm not understanding exactly what you're trying to explain. and things become more clear. So it's so important. It's something that, it's, if you can do any work on it beforehand, it's definitely going to be only helpful.
Thank you so much. Penina?
So just to address the Hebrew for a second, I did do medical Ulpan. I did a little regular Ulpan and then medical Ulpan the first year I was here. Then I did my Histaklut the year after. I agree with Adam in many ways, though, that if you're not using the Hebrew, that it's much harder to really integrate it into your vocabulary. I also do want to say, though, that when I started in the Kupot, I wrote my notes entirely in English and I stumbled along in Hebrew. The patients were wonderful and everybody knows a little bit of English, and I was able to manage along with the Hebrew I have. And now that when I can write my notes in Hebrew and I speak in Hebrew, I'm shocked that I've gotten to this place. But it really does, it's an immersion kind of thing, and you get there. And even I'm an old lady and I still was able to do it. So and everybody could do it. And there's a lot of Israelis who come in and they want to hear my English, they hear my accent and they only want to speak English to me. So that shouldn't ever feel like a barrier to somebody. Your general healing energy and knowledge is desperately needed, and all the other stuff will work itself out. I guess my biggest piece of advice is not to be afraid, because if this is what you really want to do, now's as good a time as any. It's not going to get better in terms of an opportunity. And it's a huge leap, but if you did medical school and pre-med, medical school residency, katana lechem, this is small for you. It feels like the hardest thing you do to uproot your life and to change everything. But if it's what you really want to do, I can say that it's the most exciting, exhilarating adventure, and you feel like, you can do it, you can have it all. You can live in Israel, you could practice medicine. I saw somebody brought up about whether you really need to travel in order to maintain a lifestyle here. I don't think you do. I had somebody say to me years ago, do you have an exit strategy for getting out of my traveling? And Corona became my real exit strategy. And I think that I managed, because there's enough work here that I just cut down on not being able to travel to the States. I made up the work here. And I miss my family but in the States. But with regard to the making up the financial equivalent, if you really want to make your life here, you don't have to stay attached to a practice there. It's a mental shift. But you can definitely manage here on an Israeli salary.
Thank you. Adami.
First of all, I think I'm going to call Penina every time I'm feeling discouraged, for a little, mental health. Thank you, Penina. You're very inspiring. I think I'm actually scheduled to have you, remove something skin tag on my neck soon. Okay, so I'll just tell one very quick story about why some Hebrew is helpful. It's mildly inappropriate. I'm definitely not getting invited back after this, but so as many of you may know, michnasayim means pants, right? And mishkafayim are glasses. So a colleague of mine, a cardiac surgeon, was in the middle of a code, right? And he's in the middle of chest compressions on the patient, and his glasses were fogging up. So he starts screaming, "Torid li ata michnasayim, torid li ata michnasayim," and no one's listening, and everyone's kind of just like staring at him, and he's getting very frustrated, and he finally points to his glasses and he says, "Torid li ata michnasayim." So anyway, that's why it's helpful to have some Hebrew.
So I want to say something as a user of the medical system, and I am hoping that all of our listeners will come and join us here. And this is actually taking from something that Adami wrote, but this happened to me personally. My parents made Aliyah 7 years ago, and they have since passed, both at Shaarei Tzedek, and which is where you work. And my father was intubated and basically not functioning for 6 weeks' time. And we arranged to be by his side, 24 hours. But it wasn't always us. It sometimes would have been a caregiver as well. And I got a call at 5 a.m. about a year and a half ago that that it was his time and he was passing. And she said to me, "Don't worry, we said Shema with him." And knowing that I could be in a community that wasn't my personal community, but was my overall country community that cared about my parents like I would care about my parents, was so meaningful. And then a few months later, not even like a month later, a baby was born that was named after him. And I went to this doctor that I told you get a little discount for going to. And I was so moved. I told him this whole story, and he said, "You moved me with the story." And I walked into Shari Tzedek and I gave them a donation. I said, "You don't understand. From birth, you cover us from the beginning to the end. You cover us. You care for us. You give us meaning, and we know we can depend on you like a brother or a sister." So I invite all of you physicians to really come here and participate in this and be a part of our family here in Israel because we need you and we miss you and we hope to have you join us soon. Thank you everybody for joining us this evening. And any questions that anybody has, feel free to email Nefesh B'Nefesh. And if you want to be talking to any of our panelists, we'll forward the email. Thank you so much.